Welcome to Caregiver Relief, the podcast dedicated to empowering caregivers with practical advice, expert insights, and a dose of hope. I'm your host, Diane Carbo, a registered nurse with years of experience in supporting families through life's toughest challenges. Today, we're diving into a fascinating topic, beyond normal aging, how neurotherapy can help improve focus, memory, and clarity. As seniors, we often hear that forgetfulness or mental fog is just part of getting older. But what if it's not inevitable? Joining me is Dr. Tiff Thompson, PhD, a trailblazing clinical neuroscientist, a licensed therapist, and educator. She's the founder of CEO of Neuro Field Neurotherapy in Santa Barbara, California, where she specializes in QEEG-based brain consulting, neurofeedback, and advanced neuromodulation techniques. Dr. Thompson is also the creator of the School of Neurotherapy, offering certification courses and hosting an annual conference to advance the field. With board certifications in neurotherapy and quantitative EEG, she's a leading voice in interpreting brainwave patterns and optimizing cognitive health. As a board member for organizations like the International QEEG Certification Board and Jody House for TBI Recovery, Dr. Thompson is passionate about bridging neuroscience with mental health. This episode is sponsored by myvitalvault.net, your all-in-one life organizer for aging adults and caregivers. It's designed to help you securely store your essential legal, medical, and emergency information in one easy-to-access place. Because when a crisis hits, being prepared can make all the difference. Join our Caregiver Relief community, a warm, welcoming space where you can connect with other caregivers, ask questions, share stories, and find support from people who truly understand. Visit community.caregiverrelief.com to join now, because caregiving is one of the hardest and most meaningful things you'll ever do, and no one should have to do it alone. And if this episode speaks to you, please take a moment to like, share, or comment. Every click helps us reach more caregivers who need encouragement, resources, and hope. Dr. Tiff, thanks for being here with me today. I really appreciate it. I'm really thrilled to have your expertise on how neurotherapy is transforming the aging experience for our listeners.
Yeah, that was a great introduction. You impressed me with your introduction, and thank you for your kind words.
Before we get started, could you share a little bit about what initially drew you to the field of neurotherapy?
It's a bit of a story, and I'll give you a condensed version, but I was in corporate America, actually. I was a renewable energy developer. It was my first career out of graduate school. And I happened to simultaneously decide to pursue a second master's degree in counseling psychology, thinking, yeah, I'm probably not going to use this degree for anything, but it'll be a backup career. And then I had an auspicious, serendipitous experience, and I was told that my whole life would change on one particular day by a Vedic astrologer. On May 17th, 2011, I had a seer say to me, your whole life will change on this day. And actually it did. I came across a clinic in Hawaii, and this woman put electrodes on my head, and I watched a red bar and a green bar. I had to make the red bar shrink and the green bar grow, and I had to make a mandala get big and bright and flowery and colorful. I was blown away by the fact that I was using my own brain to control the screen. Anyway, I walked out of the office that day and I thought, I'm going to do this. And so within a month or so, I quit my job. I began to go into debt. Unofficially, it took a little while, but I found everybody who I could find who did this thing, and I dedicated myself to it, which was actually really scary. It was a really scary leap of faith. And there's a long version of that story, but the short version is it worked out beautifully. And I'm really lucky that I made that leap. I ended up getting my license, my marriage and family therapist license. I ended up getting a PhD in psychology. So it's a fork in the road, and I was able to keep pursuing all the things that I'm here to do.
Explain to my listeners what neurotherapy is and how it differs
Yeah.
from traditional therapies.
So neurotherapy is an umbrella term, and it encompasses something called neurofeedback, which I do a little bit of. Neurofeedback is like biofeedback for the brain, right? So if you remember biofeedback from the 1970s, it's self-regulation. It's learning how to self-regulate your body. That's where I first cut my teeth. But a lot of the neurotherapy that I do is customized brain stimulation, multimodal brain stimulation. And that's really what I visualize neurotherapy as. So if you came into my clinic and you said, God, Tiff, my memory is not what it used to be. I'm forgetting words, I'm forgetting names. We would get a 19-channel EEG on you and something called an ERP, event-related potentials test, to see how your brain behaves under task, and give you a cognitive assessment, which will take 45 minutes, an online series of games, and then do a deep analysis of your data. And quantitative EEG it's computational neuroanalysis. So we look at your data, and there's the raw data. Just like your voice has its own tonal register, there's raw, but then you can also image it. And the imaging of it is exciting and beautiful and interesting. And you would then have a profile that would relay to me what your memory deficits looked like, where they lived, and even more importantly, what to do about them, how to target them, and
That's
how to alleviate them. Yeah. And that's where this is really interesting because, and this is where it's unprecedented, is that accepting individuals who use our system is called Neuro Field. We have a hardware software company as well, which I didn't mention in the bio. But anyway, people that use our system are doing this work all over the world. I think we're in 42 countries, but it's still not really well known, and it's exotic. And the people think, oh gosh, brain stimulation. Ooh, I don't know if I need that. And what I'll tell you is that it's low level, it's non-invasive, it's way better than medication. It's an alternative to medication. And for things like memory, you can't really medicate that out anyway. And so what we do is we relieve some of the worst symptoms of normal age-related cognitive decline.
Baby boomers are looking for alternative treatments to anything that will keep them away from medicine. And I think that this is a therapy that people are going to want to know about. That's why I approached you. Does this work for people that have had strokes?
Yeah, now I will say to you, strokes are a little bit more challenging, right? Because a stroke there's a hemorrhagic or an ischemic stroke, right? We have a bleed, or where your oxygen is choked off from the brain. And it depends on the severity of the stroke, because essentially what we're trying to do is encourage neurogenesis and angiogenesis, the creation of little new tiny blood vessels. And we're also trying to offset some of the worser frequencies, I'll just say, to keep it simple. So for instance, if you have a pretty bad brain bleed, you're going to have a region of your brain that's been deprived of oxygen, and to bring it back to life, I don't think that's an impossibility, but that's not a reality either. However, we work with many head injury patients, many stroke patients, and there are absolutely levels of rehabilitation available. It just isn't, give us 2 months and you'll be back to square one. It takes time, and stroke would be something that would take a little bit longer, maybe years yeah.
Many people accept declining focus and memory as normal aging. What does science say about this? And how are you addressing that with this neurotherapy?
Yeah, there's lots of reasons why we see it happening, right? So within there's normal age-related cognitive decline, there's pathological age-related cognitive decline, and then there's all of your dementias, right? And we're looking at that first category, which is normal age-related cognitive decline. What does science have to say about it? Okay, this is wear and tear, and things go wrong, and people have high blood pressure and hypertension, and there's little ischemic changes in the brain, and infarcts, ischemic changes are tiny little pockets of dead tissue. And that's just natural. That's just wear and tear on the system from a lifestyle and diet. And, what I would say to that is there's absolutely, number one, preventative measures, but number two, it's not something that's gone and lost forever. Of course not. This is the big perk of my job, I'll tell you, is that when something is sideways, right, with me or with any of my staff or We've all done this. And so I've done work on myself when I've moved through anxiety. And I know we're talking about age-related cognitive decline, but I brought my own child in who's 7 because he was really acting impulsive at school and getting in trouble, and worked on him for several weeks, and he's doing swimmingly, beautifully. And I just recently had a woman who, this is more your demographic, who was here because she was forgetting all these words, and lovely lady. And she went from really having terrible memory and to feeling great. And we interviewed her, right? We interviewed her for a testimonial. And she said, I never told you this, but I was sitting with my daughter one day, she said, and I had this thought, who is this nice young woman talking to me? She said, and then 2 seconds later, I realized it was my daughter. And she said, and it just jarred me. It scared me. She said, I never told her. And she said, this is the first time I'm telling you because I didn't want to scare her in front of you. She's just one case example. I actually love this demographic because it's a cleanup job. It's a bit of polishing. It's not like, oh my God, this is going to take us a year. It's give me like 3 to 4 weeks. And people fly in and do this work with myself and my husband, but there's clinicians all over the place that do this, like I said. Yeah.
What does a normal session look like?
Oh, such a good question. Yeah, that's a great question. It must look pretty exotic. It's something that I've been looking at for a decade and a half now, but most people have several electrodes on their head. I'll show you what those look like here. Depending on what we're working on, we're going to target different brain regions, right? So just simple silver chloride electrodes. And then on top of that, we'll put a mesh cap. And then on top of that, we'll put a Velcro cap. And then we put these foils, we call them. It's like this on top of the cap. And this is a PEMF. So that's pulsed electromagnetic field therapy. And that's like a vibratory soak. And then we use lights. We use photobiomodulation. So when I say multimodal neurostimulation, the electrodes themselves, which is the heaviest hitter, can give a really almost an infinite number of protocols. And we have hundreds that we've developed. Again, it's customized to the individual's brain. So that's palpable. You can feel it, not painful, itchy, prickly. But people get used to it, and they'll sit and they'll meditate, or they'll do some sort of reading, or they'll watch a show, always something relaxing, or we'll give them some sort of occupational therapy thing with an iPad. And so it's a lot of folks come in for two sessions a day when they come in from out of town, and many will come for about 2 weeks. And that's about 20 sessions, 5 days a week. And people come in from everywhere. We have a couple here right now who was in a bad car accident, and they're also in their 70s, and they're coming for rehabilitation. So what's neat about it is that it's fast. It's fast, and it's not drugs. So what I'll say to folks is, it's not, if you can't operate on it and drugs, you don't want to take drugs, then this is where we fit in.
I worked with head injuries for years, so I know the challenges they have, and it's fascinating. Now, I have a question. I have a dear friend who's going for TMS for depression. How does that differ, or how is that related in some way?
Good question again. Yeah. So I used to be the vice president of a TMS company in town, a clinic in town. So I'm very familiar. So when I describe neurostimulation to people, I do it as follows. I say, okay, there's a hierarchy. At the top of the hierarchy, and I'm going to use an analogy, a sculpting analogy. So hang with me here. At the top of the grade, right, is electroconvulsive shock therapy. Now that's what you've seen in the movies, right? And that's a forced seizure. It's like a stick of dynamite, right? We don't do that. So old school and a bit barbaric, and it's usually for really treatment-resistant depression that's pretty bad. You go down a step, and we are at transcranial magnetic stim, TMS. TMS is a magnet that's used it forces a depolarization of the neurons underneath the magnet. So what that means is it makes your brain fire right there. And it feels like a woodpecker, maybe a little bit harder than a woodpecker. For depression, the protocol that they use, or the placement, is at a region called the left dorsolateral prefrontal cortex.
Of course.
And here's where this is interesting. So the reason they do that there for depression is because the biomarker for depression, it's called an alpha asymmetry at the left. And I won't give you more details than that. There are so many variations of what depression looks like, of what anxiety looks like, of what, so it's silly. I get it. They have to get to the FDA on something, but to say, oh, this is what depression looks like.
Yeah.
And that's what we do to it, is it's that one size fits all model that's not really working. So I, in my work with TMS, found roughly maybe 20 to 30% of the patients improved with this particular modality, but I digress. So TMS does have its place. It's a sledgehammer, that force magnet. So we had stick of dynamite, now we have sledgehammer.
Okay.
Now we go down a level, and we're at what we do with the electrodes to begin. And these are all transcranial modalities. Okay. So transcranial direct current stem, TDCS, transcranial alternating current stem, TACS, that's frequency. Pink noise and brown noise stimulation, you can't hear it, but they're called noise stim, and different biphasic stimulations. Those are things that we deliver through the electrodes. And it's almost as though now you have this huge tool belt full of all these different tools that we can do for the brain. And not as aggressive as the aforementioned types of stimulation, but highly customized. Okay. And then beneath that is EMF, which is a bit of a soak, like a nice soak. It's good for the body, actually. And photobiomodulation, which is light, which doesn't fit nicely into the analogy at all. So that's what we're up to. So you have the dynamite and the sledgehammer, which is not what we do. And then you have this huge belt of an infinite number of tools, and we can choose what to do with the system based upon what it's showing us.
Wow. I thought you explained that very well, because I have done podcasts on ECT and I've done podcasts on
Cool.
EMS, and I'm finding this very fascinating because I love the personalized approach and the gentler approach. So when you put these electrodes on, what I think of is, I'm an old nurse, so you have to bear with me. I think of having to shave the head so their hair, so that the electrodes hang on them. Did they have to do that? They have to shave them?
Oh, no. I'm realizing maybe when you were working, you were still using the needles you had to hook in. They used to be painful, right?
Yes,
Okay,
yes.
okay. No, we're not there anymore. I used to work in neurology, so I know the history. No, we use a paste. We use a salt impregnated paste, and that's like a Vaseline kind of, and that's how we secure the electrode to the head, and it just transmits electricity.
Yeah,
Yeah.
fascinating to me. Now, you talked about the transcranial direct current stimulation, and then you talked about the pulsed electromagnetic field, the PEMF. How do they play? How do they enhance brain health for seniors?
This is where it gets so exciting, right? So essentially what we're doing is, and this is not with the EMF as much as with the transcranial modalities, it's in either both or one, right? Or we are breaking down deviant patterns, right? And or supplanting them with new ones. So there's a balancing act. So let's just say, because this is very common, let's say that you had some memory issues, you just weren't quite as sharp as you used to be. The areas that we see that show signs of ischemic changes faster than others, degradation, put your fingers at your temples, your peace fingers at your temples, and you're at the bilateral anterior temporal poles. But basically, this is where the frontal lobe and the temporal lobe come together. And there's a great big groove there called the Sylvian fissure. And it's a vulnerable area in the brain. The left frontotemporal is all about expressive speech.
Huh?
What's that thing called? What's that person's name again? And then the back of the head, the posterior temporal, so right behind your ears, also a region where we have the junction of 3 different lobes of the brain, temporal parietal occipital junction. So these are naturally weaker areas to vascular changes and atrophies and things like that. And so that's where we often see pockets of slower alpha content. Alphas are clocking speed, your upload download speed. So it naturally slows down just a bit as we age, but when it slows down a little more than just a bit, often that's where we're going to see these changes. And the range that they respond to is roughly a 13, 14 hertz range. And
Okay.
so that's if you could clap 13 times a minute, that's what that would be. And it's a magic frequency range, actually. There's been studies that have shown that this enhances blood perfusion greater than any other frequency range, which of course will bring in oxygenated blood and lead to all kinds of wonderful things. Yeah.
Now, as a caregiver, what signs should someone look for to know if their loved one's cognitive changes might benefit from neurotherapy?
That's a tough question to answer because, yeah, anybody really can. Like, it could
Okay.
be somebody's 60-year-old husband who just is not he's forgetting more than he used to, or he's not as on it as he used to be. That's super subtle, but that would be a great kind of case. But it's these things like, God, why did I walk into this room? What am I doing in here? Or
Yes, I do that. I go, all right, what did I come for? And multitasking is really bad, and women do it more than men. And multitasking doesn't give us it's destroying our brains because we're not focused on one thing at a time. I've learned that, and I'm making myself be focused more.
yeah,
But
yeah.
I find this therapy very fascinating.
Yeah. Yeah. Let me just say this much. You will be able to multitask again.
Yeah.
As a woman, it's a hard thing to get away from. You know what
Yeah,
I mean?
I
Yeah.
know.
Yeah.
Absolutely. I agree. But
Yeah.
now, what are some practical at-home strategies that a family caregiver or a senior can use to go along with their neurotherapy or to support their focus and memory? Is there things they do at home to continue?
Yeah. Yes. So actually, a lot of times if somebody's undergoing a regimen here at our clinic, it's the things you already know about. Let's eat healthy, lots of greens, lots of vegetables, exercise, get outside, get sunshine, don't smoke, don't drink, don't watch too much TV, blah, blah, blah. When people come into our clinic, after stimulation, they're in a 90-minute window of neuroplasticity. And so their system is literally more plastic, more malleable. And it's an incredibly rich time to learn new skills or try to ingrain those things that they want to see occurring in their lives. Now, as we move through treatment, we will get new EEGs, we'll get new maps, we'll get new data at session 10, at session 20. If someone wants to go 10 more, at session 30. And the whole point of that is to quantify their changes, right? So it's not just, oh, good, you feel better, so glad to hear it. But and this is why, right? We're seeing a 72% reduction in the amount of theta content. And I'm not surprised at all that you're finding that words are coming easier and your memory's clearer and your focus is better. So after somebody is done with that, a lot of times they just move on down the road and continue on with life. But sometimes they'll pop in for a spot treatment. And sometimes people say, I've gotten this far. I'll see you in a couple months. And they'll go back to their home and they'll maybe come back for another intensive in a couple months. And that would be more challenging cases.
Yes,
Yeah.
yes. Oh, I can see I need this.
Come on over. We'll give you a blue
But I
light
love Santa
special.
Barbara. Now, how do you find you? How do you find the neurotherapy anywhere in the United States?
Yeah. So listen, here's a bit of a trick. Number one, there are clinicians of varying competencies.
Okay.
And the system that I use, this multimodal neurostimulation system, is called Neuro Field. And we teach people all the time, and we have hundreds and hundreds of students. So there's a lot of qualified people out there. One way, actually, this would be the easiest way, is we have a directory, and someone could just call our office, Neuro Field Neurotherapy office.
Uh-huh.
That would be neurofieldneurotherapy.com. And we could tell you who's close to you.
Great.
Right now, we're updating our provider directory, and we're going to be rolling out a neurostimulation certification program so that people have a stamp, and you'll just know who's worth their merit.
So that's
But
really important that,
it is.
it really is that people have a certification or something to prove because I find some of there are people out there that are willing to take your money for different things without any kind of knowledge and yet I just
Yes, yes. And so what I would say then, just for someone who's that's a lot of work, I would say that if you're looking up neurotherapy in your area, if you're working with someone that has a QEEGD, that's a quantitative EEG diplomat status, QEEGD, that's a good sign. That
okay.
means that they've gotten vetted and they've been marked as someone who knows how to do this. And the other certification is board certification in neurotherapy. and it's BCN. And so these are two of the certification programs that we provide education for. Now, we're not the credentialing body, but we provide education with the School of Neurotherapy. Yeah.
I think this is fascinating that you're out there teaching the future students for this field. Now, what excites you most about the future of neurotherapy?
Oh, so this is original knowledge. What we are up to is not out there yet, right? So it is a brand new field. It's unprecedented, this multimodal neurostimulation thing. In the sense that, of course, there's been studies on TDCS, there's been studies on what if we give 6 hertz to this person, or what if we do this, but this customized multimodal neurostimulation modality, it's a dark horse, right? So what's exciting about this is that it's not really known yet, and it's about to happen. And we're at the head of the crest of the wave, or the head of the movement.
That's exciting. If people see like dementia, the signs and symptoms of dementia can occur as early as 20 years before a person has a diagnosis. Are there times within that period that a senior or family member should probably look for neurotherapy to try it?
Yeah, we certainly have. I'll have to say, one of our favorite clients is somebody who's in her 80s, and she has some of the biomarkers of dementia, and she wants to get ahead of it. And so she's doing that, and she's just
At 80, God bless her.
yeah, she's brilliant. She's brilliant. I want to be like her when I grow up. But as you said, there's going to be a lot of normal cognition
Yeah.
while we're seeing plaques and tangles and these things are arriving. And then we see MCI, then we see mild cognitive impairment, and then people move into whatever, Alzheimer's or frontotemporal or Lewy body or vascular or you name it. And I will say this much, I would hang a shingle for dementias if I felt confident doing that. What I can say about dementias is we're better off catching them early, right?
Yeah.
And preventing that decline. Because once the degradation has occurred, then it's harder to get back the faculties and the functions. Yeah.
But this is a hopeful treatment that maybe as it advances can be revolutionary.
Absolutely. And the pieces of it are already out there for this particular demographic. So PBM, photobiomodulation, which is light therapy, there's a whole industry that's popping up around that one particular component of it for this kind of disorder, for dementing conditions. Yeah.
Fascinating.
It's coming. It's coming.
Tiff, how do my listeners find you?
So my website's, like I said, Neuro Field Neurotherapy or School of Neurotherapy. But my email is my name. It's tiffthompson@gmail.com. And I'm pretty friendly, and I have a brilliant staff that I work with, and I'm happy to help anybody in any way. I'm here to serve. If anybody hears about it and they're intrigued, then that's great.
I create a permanent page on my website with the podcast with your headshot and links to your social media and everything that you've sent me, and links to your site so that people can explore your website and find more information out about neurotherapy.
Cool. Yeah. You're a trailblazer. You really are.
Too, yeah. I just want people to know what's out there. I really do. I think it's important. So
For sure.
thank you so much for your time. I appreciate it. And to my family caregivers, you are the most important part of the caregiving equation. Without you, it all falls apart. So please learn to be gentle with yourself. Practice self-care every day because you are worth it.